Thanks, Adam. Again, very briefly, what are we talking about when we talk about tertiary spine center? We're now talking about, in Botswana, only one center. As we heard from Ian, there are a number of such centers throughout South Africa, and mostly European and America had too many such centers. But here we talk about Princess Marina Hospital and perhaps eventually UB Hospital and some of the private hospitals. The issue is exactly, and I'm going to reiterate this because this is our problem. We have to avoid silos. We don't want the nurse practitioner in the village to be working without any knowledge or out communication with the family physician, with the primary spine care clinicians, the chiropractor, the physical therapist, the secondary spine care settings in the district hospital. And we want them to work together as a unit so patients go to the correct level of care for their condition. And the classification of the Global Spine Care Initiative now shows or gives some indication as to which patients can be managed for the majority of patients, which are managed with less invasive treatments, and when those have failed, what you might move on further. Manage initially if able, otherwise you refer, or triage only and refer to additional topic. And you'll notice that what we're suggesting here is that everybody with ordinary back pain, class 0, 1, and 2, should be triaged by the tertiary referral center and sent out, not sent up the ladder. There should, and we would hope that eventually at the Princess Marina Hospital, when we've got our center, our World Spine Care Program organized, that this will be a triage center to avoid unnecessary use of the tertiary services. Again, it's now in a completely coordinated, patient-centered program where everybody's communicating with each other. The tertiary program is mostly neurological disease, mostly deformity, as we've already heard, and some of the visceral disease, the cancer, and so on. We're going to get a lot more information on that. We're talking at the bottom of this inverse triangle at the very few patients who need it compared to the number of patients out there who have serious pathology. We're avoiding this, and I reiterate, this is what we're trying to avoid, and we're talking about this limited number of patients going to a tertiary center. This is an example. Simeon Amagakli is a 12-year-old Inuit boy, this happened to be up in Canada, who had marked spine deformity. He and his family are experiencing psychological stress. He's having more difficulty with sitting for prolonged periods of time and walking. He has been screened at school and known to have a severe scoliosis. He's been followed at a local spine care facility and referred for imaging. Note that the scoliosis continues to progress. He's having difficulty at school due to inability to sit for prolonged periods and teasing of his appearance by classmates. And the question is, what can be done in a tertiary center for this person with neurologic disease, the person with other systemic pathology that requires advanced care and advanced rehabilitation? Thank you.